Just had my hair cut, what do you think? Do I look 10 years younger? That bang, that cannon that just went off is goes off at 12 o'clock every day. It scares the living daylights out of tourists because they all think there's been some kind of terrorist attack. But there's kind of an interesting story behind it, because it actually was started by, I think, an English general who was living here, and his wife used to go out with her friends for a walk on a morning, and he said that she often got carried away chatting to them and was late back to prepare his lunch. So he fixed up a cannon on the top of the chateau, and every time she was late, he launched one into the sky to tell her to come home and make his lunch. Them were the days, eh? None of that women's lib rubbish. Anyway, the purpose of this video is not to tell you about the Major and his cannonballs. It's to bring you up to date on what's happening in Nice with COVID-19 and with tourism, and what's happening in our lives here, because it's well, it's an interesting time. So what I'm going to do is I'm going to take you on a wander around the old town of Nice, so you'll get a picture of how many tourists are here or not, and I'm going to try and tell you what's happening in terms of France and COVID-19 and how things are working. Before we get started, the usual appeal: please hit the subscribe button down in the bottom of the corner if you're enjoying what I'm doing. Hit the bell and you'll receive notifications when a new video appears. Anyway, just to put this in perspective, it's 12:25 p.m. Here in Nice, and it's mid-September, and this would normally still be pretty peak tourist season. Wouldn't be quite as busy as August, but the old town of Nice would be very, very busy. So this is one of the most popular restaurants, one of the best restaurants actually, Comptoir de Marché. Very good food in here. You can see how many people are in. So that gives you a fair indication. The restaurants that are doing okay are the ones that have cater for the local market. Anything that's very tourist dependent or expat dependent or second homeowner dependent is pretty desolate. I was just talking to my hairdresser. I do actually have a hairdresser. Honestly, I need it. Even he said it's just an economic disaster. But that is the same across the world. So, what is happening in France and in Nice, and what do I think about the way the French government are handling the whole COVID-19 situation in relation to, say, the British government? Because it's kind of interesting to look at the different approaches, because they are very different. There's some overlap, but there's some very, very different bits. First off, what's happening in terms of numbers here? Well, as you probably read in your papers and stuff, the infection rate here has gone very, very high. Over the weekend, I think we averaged nearly 8,500 cases per day. Now, obviously, some of that is to do with increased testing. There is a lot of testing. I can and have had the antiviral test in the clinic in the village of Villefranche, literally a few hundred yards from the house. And I did laugh today when I saw that I heard on the radio Matt Hancock saying we aim to make sure that no one has to travel in Britain more than 22 miles for a COVID test. And I kind of thought, Christ, I'm going to have to travel about 220 metres, and I live in the tiniest of villages. And I think that is in part to do with the fact that the way the French health system works is it's very devolved. So you've still got an awful lot of small clinics spread across the country. You haven't got this centralised super hospital system. It works differently because, for example, if you have an X-ray in France, as far as I can see, you don't really go to the hospital. You go to a radiologist, and the x-ray is taken, and then you are given the x-ray and you bring it back to your doctor in an envelope. You often see people walking around Nice with envelopes with their pictures of their knees in, and hips and things like that. So that's just one of the word quirks. So obviously it's partly to do with that, with testing, but it is not solely to do with that. And that is evidenced in the increase in hospitalizations. Now, it's not been a big increase, but there has definitely been an increase in hospitalizations. And I think it's something like 4,500 people, or a little bit more than that, who are currently in hospital in France. Now, in this region, I think probably the most interesting stat of the last week is that out of the 1.5 million people in the region, there were 5 people in intensive care, and this week there are 13. Now, you might think, well, that's not a very big number, and it isn't, but of course, as with all of this stuff, the rate of increase is the bit that has to be watched, because obviously that can very quickly speed up and the growth can become exponential. But so it was a 175% increase, 5 to 13. Which is significant. What are the French doing about it? Well, these things are meant to be worn absolutely everywhere, inside and out. And I'm just going to some policemen up here, so I better put mine on properly. Although I have to say, I've seen quite a lot of policemen not wearing them. But these things are meant to be worn everywhere, inside and out in Nice. That's very, very clear. In certain areas of France, Marseille I think is one, they've introduced a sort of curfew, which means I think the bars have to close at sort of like 10 o'clock, which is, I can't guess what Britain has just introduced as well in Bolton. So that's what they are doing. At present, there is still major resistance to any kind of lockdown that is heavier than that. There's certainly not been any indication that in Nice we are heading to a second lockdown. I guess the problem will come for the French if the hospitalizations rise significantly, and if there is a possibility that the health service gets close to being overwhelmed, as it did in certain areas in March and April. But at the minute there is no sign of that. And I have a strong feeling that the French intend to try and tough this out and live alongside the virus. Whether that succeeds or not, we shall see. So, if you're thinking of coming to the south of France this autumn, can you? Yes, the answer is you can. And in fact, a friend of mine has arrived this week. We're having a great time. But, and more to the point, do you know how much he came for? £5 each way. I spotted that Ryanair, Mr. Lovely, Mr. O'Leary, my favourite airline person, was offering £5 each way tickets, and lo and behold, they did actually exist. I think it cost Chris more for the bus to Stansted Airport from East London than it did for the flights. But anyway, you can do that, and when you get to this end, there is no quarantine. You don't need to quarantine. You are offered a COVID test at the airport. You don't have to have a COVID test, but you can have one. You can nip into a little tent and have it done. And that's the way it works. Now that may not remain. That may not remain, not because the French have decided to act unilaterally or to introduce reciprocal quarantine after what the British did, because we thought they were going to do that, and there were a lot of indications they were going to do that, but ultimately they decided not to. But that will change, ironically, because of our old friend Brexit. Because what is happening now is the European governments are getting together to try and agree a standardised rule about when to introduce quarantine on a country. They're trying to act as a bloc, obviously, because they want to keep the unity of the 26 countries that are left. So they're going to try and decide, like Britain has, that, say 20 cases per 100,000, and that means that you have to quarantine if you come into France or into Germany or into Spain or wherever. So once they've decided that, they will act, and I'm afraid it almost certainly will mean that because Britain is no longer part of the 27, we will be subject to the same rules as any third country would be. So we've got friends who are currently stuck in America, and they can't presently return here unless they can prove they live here, and if they do, they will still have to quarantine. But they certainly can't return as tourists. So it may be that the British will be allowed to come into France even if their COVID rate is over the threshold that the EU determines. But I suspect that going forward through the winter and into the spring, that unless the infection rate in Britain drops considerably, you will probably face quarantine at this end. But that has not been introduced yet. As of today, that is not the case. You can freely travel into France. There are plenty of flights. They're incredibly cheap. But if you fly back, of course, you are obliged to quarantine for 14 days. Of course, it would be much more sensible if we had airport testing and we cut that down to 5 days, as the airline industry has been arguing. But, you know, when did sensible things ever seem to be favoured by the British government? Does it feel safe? It's the question I ask every time I do one of these vlogs, because I know it's the question that people ask me. Well, it feels to me, and people who come from London say that they feel safer here than they do back there. But if you look at the figures, there is no doubt that the infection rate is way higher here at the minute than it is in Britain, though Britain has always been a few weeks behind continental Europe, and I've always felt that it was sort of inevitable that the rate would rise in Britain, and it is, and I suspect it's probably inevitable that it will go on rising. So you have to decide, I guess, how vulnerable you feel to the disease. If you're young, you may be greatly less worried about it than coming here than you would be if you were in your 60s, 70s or 80s. And if you had an underlying health condition, etc. So it's that really is up to you. But there's no question that the infection rate is amongst the highest in Europe now. My best guess on what's going to happen going forward in France, what's going to happen going forward in Britain, well, I think it's inevitable the case numbers are going to rise. I don't think there'll be a vaccine this year, and I think even if a vaccine emerges, it's more likely to be a sort of 50%, 60% effective vaccine. It's not going to be a cure-all. I think we're looking at basically next Easter for the world to begin again. I don't think there'll be any theatre of any meaningfulness before next Easter, and I don't think travel will become greatly easier until that time. So on that level, I think I'm pretty pessimistic about the travel industry, about the theatre industry, etc., etc. I'm a little bit more optimistic that I don't think we'll see the same number of deaths this winter that we saw last, let's hope, but I'm no doubt we will see an increase. We have to go on living. We ain't got a choice. Anyway, tomorrow we're going to cycle to Italy, to a little town in the hills where there's a very famous mushroom restaurant. I feel a vlog coming on. Don't forget to subscribe. You wouldn't want to miss that one, would you?